Good morning. Aloha, everyone. So we are here for the joint hearing on Committee of Human Services and Committee on Health and Homelessness in Conference Room 329, Thursday, February 8th, 9:30 a.m. I'm here, Lisa Martin for Human Services, and I have Chair Della Bellotti for the Committee on Health and Homelessness. And we'll get right into our agenda. First up is HB 2309 relating to homelessness. It establishes a homeless triage center program within the statewide Office of Homelessness and Housing Solutions in Department of Human Services. That's what it says. So we have up to testify. Is Angie Knight here? Okay, please come on up. Yeah. From the Institute for Human Services.
Hi, Angie Knight with IHS. Hello, chairs. Yes, so we are in support of the Homeless Triage Center. We've seen a great need since the time that we wrote the testimony to now. We actually now are at 102 successful exits. This week we're welcoming guests from Hawaii County, and next week someone from Maui County. However, although we support the passing of this bill, we do want to make an amendment. We suggest having the Homeless Triage Center actually under DOH's ADAD program, since it is so clinical, and we would need that consistent monitoring. And Imiolapia currently is the only ADAD accredited community-based medically monitored center in the state.
Great. Thank you very much, and stick around for questions after. Do we have Laura Thielen on Zoom? Okay. So we had written testimony in support from the statewide Office on Homelessness and Housing Solutions, from Partners in Care, and from 2 individuals. And is there anyone else who wishes to testify on this measure? Seeing none, members, are there any questions?
I have a question for IHS. And it's a little odd, but because you're here and I'm very interested, did your detox center go through the certificate of need process? Are you aware of that?
That is a good question. I am so sorry. I do not know the answer off the top of my head. I can text Connie right now.
Okay, that would be, I'm just interested because where you folks sit is where the IRC, the Evole Resource Center, which may be doing some similar kind of crisis stabilization as you folks are doing.
Yes.
Had to go through a CON process, and I'm just curious because it is something. It's another matter that we're talking about. But I appreciate the work that you folks are doing. It's a much needed medical service in the community, and you folks have really filled a gap. So thank you.
Yeah.
Okay, you can stay there. Okay. Anybody else have questions? Okay, I do. Thanks so much for being here today. Good morning, Bert. So what is your relationship with ADAD right now? Are you folks, how are you funded? Are you county funded?
So it's, we had this GIA grant to start up the program, and then, I'm trying to remember off the top of my head, I'm so sorry. And so I know we had a different partnerships. We have ADAD accreditation, and we also, are you talking about the fees for service or?
Just how your program is funded. So I'm just trying to understand the ADAD role, because I had originally thought that was a county program.
Okay.
So I was just trying to understand.
Yeah, so we, right now for the fees for service, that's through different insurances. And I know, really should know this, so sorry. But so we have the GIA grant, which got it started, got the program. We had different community partners help with the infrastructure of it, with the different furnishings. And then we have a few different hospital and partnerships also providing care.
Okay. Well, I really appreciate your testimony, and we're going to meet for decision-making in a couple hours, and I will take that into account when amending the bill. So thank you very much for coming today.
Yeah, thank you.
All right. Moving on to our next measure, HB 2325, relating to homelessness. It appropriates funds for the continued implementation of the Return to Home Pilot program, which we established last year. And we do not have anyone signed up to testify in person. We have written support from the statewide Office on Homelessness and Housing Solutions, from the Department of Human Services, and from 2 individuals. Is there anyone present or on Zoom who wishes to testify on this measure? Seeing none, members, there's no one to ask questions of. So we will we'll reconvene at 11:35 for decision making on these 2 measures, and we will adjourn. All right, good morning, everyone. Thank you for being here. It's Thursday, February 8th, 9:45 a.m., conference room 329. We're here for a hearing on the Committee of Human Services. My name is Lisa Martin, Chair. We have Teresa Mato, our Vice Chair, members Della Bellotti, Jenna Takanucci, Diamond Garcia, and Bert Kobayashi. And our first item, I did want to mention that we have an item added to the agenda, HB 2555, just for decision-making. And we'll actually do decision-making at 11:35 today. Our first item up is HB 1670 relating to mobile clinics. It appropriates funds to the Department of Human Services to purchase, staff, and operate mobile treatment clinics that provide services throughout the night. And we have testimony with comments from the Department of Human Services and in support from the Hawaii Primary Care Association. Nobody had signed up to testify in person. Is there anyone here who would like to testify in person or on Zoom for this measure? Seeing none, we will move on to our next measure. Of who?
I believe DHS is here.
They're
so
just hiding in the back. Okay.
I would like to ask you, since you did submit testimony. So I appreciate in your testimony that you state that a more efficient way to appropriate funds is to support existing community-based services. As I understand it, your homeless program services are the funds that would actually fund this type of mobile clinic. Is that correct?
Well, they fund homeless outreach, and some of the organizations we contract for homeless outreach also have separate programs in which they have mobile clinics. For example, Hawaii Health and Harm Reduction Center, I think, has a mobile clinic, but it's funded through a separate source. But they, I think, align it with our homeless outreach program, so they use it as a component.
So I also understand that maybe there's other FQHCs that have mobile health clinics and other programs that have adopted mobile health clinics. And I wonder if the department has any insights into what that cost might be.
That would be probably something we would need to circle back with some of our other divisions. So I apologize. I'm Scott Morishige with Benefit Employment and Support Services Division. So we would probably need to consult with MedQuest Division to come up with an estimate.
Okay, but it doesn't need to be MedQuest. It could be the homeless programs offices as well, right?
Potentially. I think it depends how the mobile clinic is targeted and how it's described in the bill. I think currently as written, the description is pretty general.
Okay, and I guess my thinking would be that, you know, the House majority is looking at boosting the homeless programs office budget. That is just to kind of bring them up to cost of living increases. So if we were to do an additional funding request for these types of clinics, whether they're in DHS Homeless Programs Office or DOH ADED, I don't know where, but it would be good for us to have a number so that we could put it forward in a committee report. That's over and above what we already want to do for existing services.
I can go back and talk to our program staff about it and circle back.
Okay.
Thank you.
Thank you very much. Any other questions of our non-testifiers?
Scott,
Scott, sorry.
it sounds like you were not consulted by the author because the bill does not state what kind of services will be provided throughout the night. Maybe for insomniacs? Or, I don't know, people with headaches or constipation or what? If you had your choice, what would be the dollar amount and what would be the services provided throughout the night, quote unquote?
So again, there's a broad range of services that are
course.
provided through mobile clinics now. I think many of them that are in existence, as I think Chair Bellotti mentioned, are tied to health centers, the FQHCs, and provide access to street medicine or mobile medical services. We potentially could add it as a component to our homeless outreach program. And again, I would need to consult with our program staff to get a more accurate estimate. But we can certainly do that. And like you mentioned, Rep. Kobayashi, right now it's very, very general how it's described in the bill. But I think depending on how the legislature chooses to target it, it could potentially be with DHS Homeless Programs Office, or it could also potentially be with another agency, depending what you want the focus to be.
Sorry.
Thank you.
So I have a homeless outreach, or not homeless, a mobile outreach clinic in my district, and it's definitely a daytime thing, and it does target the homeless. I have a feeling the author of this bill, being that he represents Waikiki, had in mind something maybe connected to the late night activities in that area associated with bars, maybe overdosing, things like that. Would that take us out of homelessness if we're targeting that group?
Potentially, because if the intention is to just overdoses, for example, that's not something that's just limited to unsheltered individuals. And I believe Hawaii Health and Harm Reduction Center does a lot of services that address that particular area.
Okay, thank you very much, appreciate
Thank
it.
you.
Members, are there any other questions of those who did not sign up to testify? Okay. Then we will move on to our next measure, HB 2186, which is, requires the Department of Human Services to develop a safe parking program allowing unsheltered persons who sleep in their vehicles to park overnight on state lands. And our first testifier would be the Department of Human Services. Thank you. With comments.
Good morning again, Chair Martin, Chair Bellotti, and members. My name is Scott Morishige. I'm the administrator again of the Benefit Employment and Support Services Division at DHS. The department stands on our testimony with written comments, and I'm available to answer any questions. Thank you.
Thank you very much. Next up, we have on Zoom the Honolulu Police Department, and I see he is present. Please go ahead, sir.
Good morning, Chair, Vice Chair, and members of the committee. I'm Captain Clifford Ramson with the Honolulu Police Department, and we stand in our written testimony in opposition to the bill, and I'll be available for questioning.
Thank you very much. We also have on Zoom, potentially, Partners in Care. Is Laura Thielen here? Okay, not present. We have written testimony in support from the Office of Wellness and Resilience, from the Institute for Human Services, from ACLU, and one individual. Is there anyone who would like to testify in person? Please come on up.
Aloha, Chair, Vice Chair, and members of the committee. Tia Hartsock, Executive Director, Office of Wellness and Resilience. Excited for this bill in terms of the outlook on implementing trauma-informed principles in the state throughout our state departments. Deferring to Department of Human Services on this measure, however, supporting the intent. I do want to state and note that the need to coordinate services like this and determine what type of services for unsheltered people who sleep in their vehicles and park on state lands would be needed to have further discussion. We understand this is an extremely vulnerable population and needs to be, services need to be created in a trauma-informed manner. A lot of these principles that apply, including safety, peer support, empowerment, voice and choice in the trauma-informed care principles, will help us lead down a pathway that will inform and create a trauma-informed state. So support the intent, open to discussion, but defer to Department of Human Services. Thank you.
Thank you very much. Is there anyone else wishing to testify in this measure, in person or on Zoom? Seeing none, members, are there any questions? Seeing none, I have some questions. My first question would be for HPD. So I see, I understand in your testimony that you have concerns that this contradicts the statutes which basically prohibit people from using parked vehicles to live in between 6 p.m. and 6 a.m. But that's on city streets and certain places. Can you conceive of places where it would be okay? So for example, if it was incorporated into an Ohana Zone project, which was not on a street or other public place, but it was state land, not a park, not a street, but some other, part of a project with land that is dedicated to that purpose, would there still be an issue with our law?
I think where HPD is coming from is, although we laud the efforts of the originator of the bill, to try to find establish safe zones or a place that's safe for people to park and habitate in vehicles. Our experience and experience in other jurisdictions have shown that safe zones tend to create problems of their own, and mainly in the area of safety and security. Yeah. So I think where we're looking at it is, not only may it encourage lawless activity, because now you're putting people together in a place that's somewhat unregulated. You don't have that 24-hour security aspect that provides that level of safety for that vulnerable population. So I think that's mostly where we're coming from, and that is from a safety and security standpoint.
Thank you very much. I do know that in my district,
question.
we have this de facto in our beach park, and it is a real problem for my constituents, for sure. So I would much prefer it be regulated, but I do understand and hear you that it needs to be a regulated situation where there is safety control, so thank you. I had a question for DHS. This would really be more of planning and developing the program. What kind of cost would that be for the department? So we could add that into our thought process.
So, we would need time to come up with a more accurate estimate for the committee. I think in our testimony, we note that if the bill proceeds, we'll continue to assess the program and come up with a better cost estimate as it goes through the legislative process.
What about just if it wasn't even funding the actual program, but just going through the thought process of thinking, how could this work, and having discussions with existing programs? Could this fit in with, Ohana zones or other projects? What would that be?
Well, I think, again, because there's a number of different factors to think through, I think what's being contemplated here would require coordination across multiple different agencies, possibly both state and county level. And we would want to make sure that our planning encompasses all the different factors. So it's difficult to come up with the exact cost estimate right now. We did note in our testimony, however, that statewide Office on Housing and Homeless Solutions is currently implementing Ohana zones and Kohala. And we also want to make sure that they have time to fully implement and scale out those projects, which could include the type of program being contemplated here.
Okay, thank you very much.
Thank you.
Members, are there any other questions? Okay, then we'll move on to our next measure, which is HB 2284, relating to the Hawaii Able Savings Program. This is to promote use of the program with some different strategies. And we have testimony in support from the Hawaii State Council on Developmental Disabilities. Daintree, please go ahead.
Thank you, Chair. Thank you for hearing this bill. My name is Daintree Bartolos, Executive Administrator for the Hawaii State Council on Developmental Disabilities. We are in strong support of this measure. I'd just like to emphasize in our testimony, we did comment about a study that was done that shows 43,000 children under the age of 18 could qualify for this Able Savings Account. From that report, 40% of the 43,000 live in poverty. And so the savings accounts, by emphasizing and supporting them, we could break the cycle of poverty. We could save for individuals. So many years we've been telling people you can't save, you're going to lose your benefits if you save any money. And so we just keep them at that threshold below the poverty level. By incentivizing ABLE accounts and showing support for them, we could break that cycle and they could save and become contributing members to society. We also have 23,000 individuals with IDD. Adding everything up, over 100,000 individuals could qualify for ABLE savings here in Hawaii, minimum. And right now we have a little over 100 because not too many people know about it. And so we really want to incentivize it and get a staff to promote it. Thank you for this opportunity to testify.
Thank you very much. We also had written testimony in support from the Disability and Communication Access Board, Executive Office on Aging, Department of Budget and Finance, and I'd note that in their written testimony, they were very enthusiastic about managing the incentives, and the Hawaii Disability Rights Center. Is there anybody wishing to testify in person or on Zoom on this measure? No? Members, are there any questions? No? Well, thank you for being here today. This seems like a very worthwhile thing to promote. All right, next we have HB 2662, which requires the Hawaii Public Housing Authority to establish a 2-year recreation and education upward mobility pilot program for youth tenants in public housing. And our first testifier is the Hawaii Public Housing Authority.
Morning, Chair, Vice Chair, members of the committee. We stand on our testimony in support.
Okay, thank you very much. We also had some comments from the State Procurement Office, and we have Danson Honda here to testify in support.
Aloha, members of the Human Services Committee. My name is Danson Honda, and I am testifying in strong support of HB 2662. Notably, this pilot program this bill establishes will have an educational component that will teach financial literacy skills. I'm passionate about this bill because I experienced firsthand the upward mobility that financial literacy can bring. I grew up in a single-income family of 4 in a small one-bedroom apartment. And for the first 20 years of my life, I didn't even know what it was like to sleep on an actual bed. I grew up thinking that going to school, getting good grades, and going to college was the keys to success. Long story short, I was wrong. It wasn't until many financial mistakes were made that I began learning about managing finances and the homeownership process. Several years later, during the height of the COVID-19 pandemic, I became a homeowner. And I'm proud to say that I did it while working as a food delivery driver. Financial literacy was instrumental in making this happen, as it taught me that what you do with what you make is just as important as what you make. But despite everything I went through growing up, I actually consider myself to be very fortunate to have been able to learn from financial mistakes to put myself on a better track. Many people do not have this luxury, especially in our most vulnerable populations, such as youth tenants in housing. For many of our youth, learning from mistakes is not an option, as any mistakes made would mean becoming homeless. Many already are. This is why we must empower our youth with financial tools and skills they need before they go off into the real world. I'm working very hard for financial literacy to become a graduation requirement in our public school system, but until that happens, let's at least make this a reality for the people who need it the most. Thank you for your consideration.
Thank you very much. Is there anyone else wishing to testify in person or on Zoom? Seeing none, members, are there any questions? All right, I have a question, Hussein. So have you folks ever done anything like this before?
We have done it on a limited basis through the self-sufficiency program, but not specifically catered to the youth, but it's catered to the families.
Okay. What kind of budget do you think you would need to do something like this?
About $1.5 billion is a good start.
Oh, yeah, no problem.
We thought about the question. We thought maybe $500,000, consistent with the bill that we have submitted, and we'll report to the legislature at the end of the year as to the successes. It will take a little bit of time because we will intend on consulting with our youth in our housing first to see what kind of programs, and then put something together. We believe $500,000 is a good start, and then once we report, it'll be up to you to decide if you want to increase it or decrease it.
And for that amount, like how, I know you have more than one development. Would that be something at all your developments, or would it be in a pilot in a single location first, or what would it be?
We'll try to start working with the KVH because we started that conversation with the youth, and there is gangs activity and things like that. And we'll try to loop in Mayor Wright and other areas. And it really depends on the feedback we will get from whoever we procure through the procurement process, who to bring in. Until we perfect it, then we can export it to other areas. I think if it's the areas contained to where we can go and see the progress, and that may be a good idea, but we'll serve at your pleasure, whatever you'd like to see. If you want it statewide, we can look at that as well.
Okay, thank you very much.
Thank you.
You said you sort of started this kind of program with families, not youth.
Correct.
So would that be your preference? That is, who would be the preferred focus, families or youth?
So really there is a need for both. The reason we supported this one, because we do see a trend, as the brother behind me, my son behind me has mentioned, there is a trend that there is a tremendous amount of need for the youth. So we'll support both.
Thank you.
Thank you.
Thank you. Moving on to our next measure, which is HB 2185, which requires the Department of Human Services to develop and administer implicit bias training for healthcare professionals in perinatal facilities. We had comments from the Department of Human Services, also comments from Office of Hawaiian Affairs, but comments in support. Is somebody here from OHA? They had signed up to testify in person, no? And from the Healthcare Association of Hawaii, also comments. Is there anybody wishing to testify in person or on Zoom on this measure? Seeing nobody to ask questions of. So we will adjourn and we'll come back for decision-making on the joint Human Services Health hearing as well as this hearing at 11:35 after our wall health decision-making. Thank you very much. Good afternoon, or are we still morning? Good morning, everybody. So we are convening the Committee on Human Services for decision-making. Continuing our hearing from this morning. It's Thursday, February 8th at 11:40 in conference room 329. And the first bill that we will vote on is 2309, establishing the Homeless Triage Center program. And we are going to amend the bill to basically switch the management to the Department of Health's Alcohol and Drug Abuse Division, who has had some experience with this kind of program, and defect the date. Members, are there any comments? Or
I will just say that I did get word back from
ADAD?
Angie, that the triage center was ADAD STF accredited, and it did go through the CON process.
Oh, okay. Okay, on another issue. Okay. If that then, so that is my recommendation. Vice Chair for the vote, please.
Thank you, Chair. This is HUS voting on 2309. Chair's recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Representative Belatti.
Aye.
Representative Iligan.
Aye.
Representative Kobayashi. Excused. Representative Takanuchi.
Aye.
Representative Nishimoto. Excused. Representative Garcia.
Aye.
Thank you, Chair. Your recommendation is adopted.
Thank you.
Same recommendation for Health Committee with amendments. Vice Chair for the vote.
Health Committee voting on HB 2309. Chair's recommendation is passed with amendments. Chair and Vice Chair vote aye. Representative Amato.
Aye.
Representative Iligan.
Aye.
Representative Kobayashi is excused. Representative Martin.
Aye.
Representative Nishimoto is excused. Representative Garcia.
Aye.
Chair recommendation is adopted.
Okay. Our next measure is HB 2325, which is for funding the Return to Home pilot program. And I recommend passing out an HD with just technical amendments for clarity, consistency, and style, and defecting the date. Members, are there any questions or comments? Seeing none, Vice Chair for the vote, and Nishimoto's here.
Voting on HB 2325, Chair and Vice Chair both voting aye. Chair's recommendation is passed with amendments. Chair and Vice Chair both voting aye. Representative Belatti.
Aye.
Representative Iligan.
Aye.
Representative Kobayashi excused. Representative Takanuchi.
Aye.
Representative Nishimoto. Aye. Representative Garcia.
Aye.
Thank you, Chair. Your recommendation is adopted.
Same recommendation for Health Committee with HD1. Vice Chair for the vote.
Health Committee voting on HB 2325. Chair's recommendation is passed with amendments, noting the presence of Representative Nishimoto. Any reservations or noes? Yeah, sorry, we took one. Chair recommendation is adopted.
Thank you very much. So this hearing is adjourned. And now we decision-making on our Committee on Human Services. With the first item on the agenda is HB 1670 on mobile health clinics to work through the night. And I recommend passing with an HD with technical amendments for clarity, consistency, and style. And also taking the Hawaii Primary Care Association recommendation, Section 1, Line 5, change it to have DHS contract the services of qualified organizations rather than setting up their own program, and defecting the date. Vice Chair for the vote.
Thank you, Chair. Voting on HB 1670, Chair's recommendation is to pass with amendments, noting the excused absence of Representative Kobayashi for the remainder of the hearing. Are there any members voting no?
No vote.
No vote for Representative Garcia. Anyone with reservations? Seeing none, thank you, Chair. Your recommendations are adopted.
Thank you very much. The next measure, HB 2186, on parking for homeless. I think this has a lot to be worked out, but it's a good conversation to have. It could be coordinated and be part of the Ohana Zones projects. So I recommend passing with an HT to include a new item C on line 6, asking the department to recommend to consider how they can work within the 291C-112, which regulates uses of parked vehicles between 6 p.m. and 6 a.m. Then switch the item currently marked C, make it D. Add an appropriation of a blank amount for planning and development, and defect the date. Members, are any comments or concerns? Vice Chair for the vote, please.
Voting on HB 2186, Chair's recommendation is to pass with amendments. Chair, Vice Chair both voting aye. Are there any noes?
No vote.
No vote for Representative Garcia. Are there any reservations? Seeing none, thank you, Chair. Your recommendation is adopted.
Thank you very much. Next up, we have HB 2284, the Hawaii Able Savings Program, which I definitely support. I think it's a good bill. However, there is another measure that is moving, HB 2556, that will be heard tomorrow in the Health Committee, and I will defer this one. We'll let that one be the vehicle for this. Next one is HB 2662, which requires the Public Housing Authority to establish a 2-year recreation and education upward mobility pilot program. And for this one, we will add in the committee report that they recommend a $500,000 budget to do this program, defect the date, and then also section 1B, page 2, lines 1 through 2, put in that rather than be without regard to chapters 103D and 103F, which is our, instead put in compliance with, so we can be in compliance there. And that's it. Any comments or concerns? Vice Chair, please take the vote.
Voting on HB 2662, Chair's recommendation is to pass with amendments. Are there any no votes? Any reservations? Thank you, Chair. Your recommendation is adopted.
Okay, next we have HB 2185, which is requiring the Department of Human Services develop and administer an implicit bias training for healthcare professionals in perinatal facilities. For this one, what we'll do is create a working group that would include, membership would include JABSON, the Healthcare Association of Hawaii, Native Hawaiian Health and Cultural Organizations, Association, the Department of Health, American College of Obstetricians and Gynecologists, Hawaii Medical Board, and any other appropriate members to examine existing implicit bias training programs in other parts of the country and make reservations, and also include an appropriation to fund the working group. Members, are there any comments or concerns? Okay, please take the vote, Chair.
Voting on HB 2185, Chair's recommendation is to pass with amendments. Are there any members voting no?
No vote.
No vote for Rep. Garcia. Are there any members with reservations? Seeing none. Thank you, Chair. Your recommendation is adopted.
Okay, now we're moving to decision-making for HB 2555, which we heard earlier in the week. And Chair recommends passing with an HD that would strike section 1, and instead of amending the definition of aggravated circumstances, instead amend the definition of harm in 587A-43 to read, the child's psychological well-being has been injured, this is the part that gets added, including but not limited to by exposure to abusive or assaultive conduct by the child's family members or others who have access to the family home. And then again, amending section 2, page 6, line 19, number 8, replacing that with, in cases of alleged or confirmed domestic violence by the child's family, an evaluation or assessment of the family members in the family home who are perpetrators or alleged perpetrators of domestic violence by a service provider trained in domestic violence. And those are the changes proposed. Any comments or concerns? Vice Chair for the vote, please.
Thank you, Chair. Voting on HB 2555, Chair's recommendation is to pass with amendments. Are there any members voting no?
No vote.
No vote for Representative Garcia. Are there any members with reservations? Seeing none, thank you, Chair. Recommendation is adopted.
Thank you very much. We are adjourned.